All right. So, with all that in mind, thank you everybody for joining us for tonight's Pinellas Continuum of Care information session. This is the fifth information session that we have done this year. Previous sessions have involved veteran resources, healthcare resources, transportation assistance, medical resources, educational, workforce development, shelter resources. So there are some really, really good materials, some really good information available on those recordings. They are on YouTube, they are on our website, and I can go ahead and drop those links in the chat during this meeting, and they will also be shared in the follow-up to this. So let's go ahead and dive on in. So, of course, this is the COC information session. We are going to focus on resources for families, youths, and seniors experiencing and at risk of homelessness here in Pinellas County. Tonight's session will involve presentations from Alpha House, from Directions for Living, Family Resources, and the Area Agency on Aging. And here's just a brief agenda so that you know what we're diving into tonight. Each of our presenters will have 15 minutes to present, and then you will have an opportunity to ask questions of those presenters. So please use that Q&A box. If you see on the bottom of your screen where the Zoom menu is, where you unmute your microphone, turn on your camera, all that stuff, you'll see that there is the chat and a Q&A box. Put your questions in that Q&A box and we will make sure that we get to them. And of course, don't forget to join the COC if you haven't already. We do have some really cool membership stickers that I'm going to send out to our members this month. Go ahead and join, get your membership stickers, your Ending Homelessness Together stickers. They are going out this month. Be on the lookout for them. And we will have meetings on the horizon. Next month, we do not have a COC info session. We instead have a COC membership meeting. This meeting will take place at the Pinellas County Housing Authority, and I have been told there will be an opportunity to even tour a property. So if you have been curious what, one of these affordable properties, one of these housing authority locations looks like, this is a great opportunity to come and find out, come and check it out, and then tell all of your friends how nice the unit was. That's what I've always done every time that I've gone to these units. I leave and I go, oh my goodness, that was so nice. And then I tell everybody I know about it. So please join us for that meeting if you are able. We will also have a membership meeting on November 12th, and information will be released in the following months. And then, of course, we have 3 more information sessions this year. These are all virtual, so don't forget to join us on September 10th, October 8th, and December 10th. The registration link for that is the exact same one you used to register for today's session. So go ahead and use that link and sign up for those sessions as well. Before we dive into these presentations, I do want to let you know that this information, these resources will be shared after today's meeting. Everybody who is signed up for one of these sessions, all of our members will receive a follow-up email with a copy of the presentations that are shared today, with a recording of this presentation, and with all of the other materials that we might share or discuss, as best as I can at least, within the next week. So be on the lookout for that as well. So with all of that in mind, it is 5:35. We are right on schedule. So I am going to go ahead and introduce our first presenter. We have Miss Jennifer Strasick with Alpha House. Jennifer, would you like to take it away?
Sure. Hi, everyone. So I have been the executive director at Alpha House for 18 and a half years now. And Alpha House started in our community in 1979. It started in a little house downtown across from Williams Park. And then in 1991, it moved to our current location at 701 Fifth Avenue North. We are a transitional housing program for homeless women and babies. We serve age 14 to 41. Uh, eight of those, we have 16 beds at our location. So we have 8 beds for foster care youth and 8 beds for adults. Our foster care youth come to us from different agencies in the community. Um, FSS, all the Heartland for Children, all the foster care agencies across the state. And they are age 14 to 17. They can stay in our program um, up to 4 years because they're not old enough to sign a lease as minors. So they are the longest residents in our program. The adults that come into our program, they find us on their own and they can stay 18 to 24 months after their baby's born. The girls, the women that come into our house, whether you're a minor or an adult, our ultimate goal is to get them permanent housing and to be self-sufficient in our community. So that includes wraparound services inside our building. We have a licensed clinical social worker that does weekly therapy with the girls, and also does a parenting goal or a pregnancy goal with them. We have a life skills counselor that teaches them budgeting, um, resume building, how to do an interview, how to open a bank account, how to get on the bus. She gets on the bus with them, and so they learn to be self-sufficient in that way. They're assigned a case manager. The case manager makes sure that the minors are in school and that the adults, we encourage them to go to school, but they can work. And the case managers track that. We also have therapeutic groups internally for everybody that the topics vary for trauma, for parenting. It's a lot of different things. So the goal of the program is to work on the trauma. We have that's one piece. We have a lot of human trafficking victims. Every girl that comes into the building, whether it's a minor or an adult, has been abused in some form, and they don't have anybody to stay with. So we want to help decrease their trauma, provide them parenting skills, and get them permanent housing in the community. The our facilities open 24/7, so the every resident is supervised 24/7 in the community. One thing about Alpha House is that we are the only residential program, maternity residential program in the state of Florida that allows ages 14 to 41 and for the length of stay that we allow them for. So it's very unique to the community and the state in general. Um, which we usually don't have a waiting list for foster care girls. Actually, we recently did. We had 3 on the wait list, but we have a very extensive wait list for adults because we only have 8 beds. So um, it's something that is definitely a need in the community. So um, that is the main points for Alpha House, and I can't believe that's 4 minutes and not 15 minutes. I need to tighten that up, Victoria, for my defense because I talk really fast. We have also a community outreach program in addition to our residential program. So we get donations to the public from the public that are gently used clothing. And anybody from the community can call us up and schedule a day and time to come in and get baby items. So we like to give back, and that's a first come first serve basis. One thing I do want to point out too that is really important to know with Alpha House is you have to be pregnant to come into the program or have a baby under 9 months. Sometimes I'll push it to a year because it's not set in stone, but we are constantly get calls for women with multiple children, and we are licensed by the Department in Children Family, and they do not allow um that many children to occupy the room that they're in. Each resident gets their own room with a twin bed and a crib, and storage, and everything they need to get settled. So, Um, so we have that program is residential, and then we have the community outreach. The community outreach, before the pandemic, you used to be able to come in and sit in the lobby and look through the bins, but it's been really hard to get volunteers to help our community outreach program on a regular basis. So you have to call and schedule a time, and then we'll get those supplies ready for you. And we help the community as well. We also help other agencies. So we have agencies that will call on behalf of their clients for our community outreach program, and that's perfectly acceptable. And they'll come and pick up items, for their clients, because a lot of times transportation is definitely an issue. Um, our case managers on the residential program, they also transport the girls to school. It's mainly the minors, and to daycare. They're also responsible for all of their medical appointments for mom and baby. So, um, we have a lot, that happens internally, to try to help, get these girls back on their feet. It takes a lot of work because um they've been abused in such a extreme ways that it's hard for them to develop trust. So but that's why it's beneficial for them to stay with us as long as they do, because ultimately we have a 98% success rate with permanent housing, and only 1% of our clients return to homelessness, and that's usually clients that leave the program before graduating, and they don't get all the services that are offered to them. I recently did a dissertation on the population at Alpha House, and it's pretty elementary, but the longer you stay in the program, the more successful will be long term with permanent housing. So that is our ultimate goal, is to keep them with us as long as we can. And I think that's all I have.
That's wonderful. Thank you so much, Jennifer. So we did have one question in the chat. Do the foster care youth also need to be pregnant for the program?
Yes, it's the everybody that comes in the program, you're either pregnant or you have a baby under 9 months. So one or the other.
Wonderful. Thank you. We also had another question in the chat. Alpha House, do you teach, do you teach clients to drive?
Oh, that's a great question. We have in the past. It's not it when it comes to our attention. We have taken them to the location where you practice and stuff. But we've got vans, so it's a little bit tricky, but we've used our cars before. It hasn't happened in a while though, but yes, we have. Excellent.
You know what? Learning to drive in a van actually is a great way to make sure you pass your driver's test if you can do it in a smaller car.
Yeah, it is. It is if we can make it out alive, but that's a good question.
Do we
Okay.
have any other questions for Jennifer right now? We do have a few more minutes. No? Okay. Well, I
Thank
tell you
you.
what, Jennifer, don't go anywhere because we do have a Q&A session at the end of this.
Okay.
So if you come up with any questions for Jennifer between now and then, folks, go ahead and pop those into the Q&A box and we will make sure that we come back to them at the end of the session.
Thank you.
Jennifer, I just want to say thank you for all your work. My name's April with the Lotus Coalition. I know the Alpha House and I've known you guys for a long time. So great job of what you're doing and keep up the good work.
Thank you, April. Thank you so much.
I love that. I love kudos are a great thing, and Jennifer and her team definitely deserve them. So thank you, April. We did actually also have one more question pop in, Jennifer. Do you have a washer on site?
Yeah, we have washers and dryers on site, and we teach the girls to do laundry. They have designated days that they do laundry every week.
That is excellent. So some life skills coaching as well. That's wonderful.
Yeah.
All right. Any other questions for Jennifer? All right. In that case, then, I would love to go ahead and introduce our partners at Family Resources. But before I do that, I want to make sure my computer is telling me that y'all are looking at a black screen, but I can't see that you are. So can you tell me, can you see the whole presentation in front of you before we move on to the next presentation? Somebody tell me that you can. Okay, wonderful.
Yeah.
I thought that that was just a little error on my computer's part. Thank you very much for confirming. Okay. In that case, Miss Mackenzie, would you like to go ahead and introduce Family Resources?
So the next slide up is actually directions for living.
That's me.
Oh, so I'll introduce Michelle.
You're so right.
I'm feeling a little left out, Victoria.
Let's try again. All right.
Okay.
Miss Michelle Hansen, with Directions for Living. You are up next. And absolutely, would you like to please tell these folks about Directions for Living?
I would love to tell everybody about Directions for Living. First of all, I want to say hi, everyone. Thanks for the opportunity to let Directions present this evening, to share not only our resources for homeless and housing unstable, but for all of the resources for all of the residents in Pinellas County. So we'll start off with a little bit about ourselves, what our mission is. I think that's our next slide. A little bit about us. We have our mission. I'm not going to read it to everybody. I think we can just take a few minutes, see our mission, what our vision is, and our values. And we try to stick very hard to our 5 values. We work hard every day to hold our 5 promises. So I'll just give everybody a few minutes there to take a look. It's not fun when people read to you. All right, if you guys are ready, we'll move on to the next. And this just really talks a little bit about ourselves. Hang on, I'm just kind of following along. Just a little bit of history. We've been a longstanding community mental health provider established in 1982. We are trauma-informed, family-centered. We have integrated services. What I find very interesting is we have 220 staff co-located in 2 locations, our 1 location in Largo and in Clearwater, which is our main, where the majority of our mental health services take place. And we are co-located all around, as you'll see when we talk about some of our other services in the community. So if you want to go on. So as you can see, we offer adult and children's therapy. We have group therapy, case management. We have targeted case manager, psychological testing. We're involved with family services, family support services. We work with child safety. We have children's programs, that treatment works programs. We have mental health court. Our first 5 works with young children coming in the preschool. So we're really trying to target our children at the preschool age that are really struggling with behavioral issues in preschool. This is one of our newer programs where we have counselors that will go out and work with the parents and the children in our preschools and daycares to keep the children in daycare so that they aren't home. Then the parents lose the spot in daycare, the parents lose their jobs, therefore then they become financially burdened. So we're really trying to target our population, our young population, and get them set up for success at the very earliest stages. We have Together We Rise, Home Builders, all of our child safety programs. So then that's like our overview of all of our programs. And obviously I've saved the best for last, which is our, in my opinion, because it's under my division, and that is our housing first services. So I'd really like to do is take some time to break down each program. So we have our Family Works program, which works with any child who is in a Pinellas County school and enrolled in Pinellas County School, and it's a child whose family has been deemed as housing unstable, whether it's at risk of homelessness, truly street homelessness. We worked very closely with the HEAT team, who works with closely with every social worker at every Pinellas County school. If a child and family has been identified as being housing unstable, we have a whole referral process. They send us the referral. We have case managers and counselors who work with these families intensively. It's very intensive work. It's providing counseling to the children, counseling to the parents, really working on remediating whatever housing barriers there are. We are having huge success with this program. We have rapid rehousing programs, multiple housing programs tied into this one. And our main goal is really securing the housing and resolving that first crisis, and then working with the family to maintain stability and remediate what led to those crises. So that our ultimate goal here is watching children's stability in the classroom, their attendance, and their grades increase. That's really what we're looking to do. And again, giving our early children, our young children, our high school, that opportunity to be successful by removing the housing instability. So it's a comprehensive, housing piece to it that comes with a wealth of other supportive services that goes along with that. Again, we have rapid rehousing. So some of our families we can work with and house up to 6 months to a year, and really work with them and put in some intensive services to help them find the stability, so that we don't see them come back to us again and them have to go put their whole family through being housing unstable. So that's our housing through Family Works. We have our SOAR program that has been a staple with Directions for Living for quite some time. Actually, a little fun fact, I started at Directions for Living in the SOAR program and started doing SOAR, and I had the opportunity to work with the office in Clearwater, but I also was posted at the Public Defender's Office and had the opportunity to do SOAR out in all the co-locations in the community. And that's the same with SOAR now. They have our office in Clearwater, but we also have 2 case managers who are outposted at the Public Defender's Office, who are really working with that set of clients to, again, bring the mental health that we provide to these people, to these clients, so that we can shore up their mental health, help them get stability. And SOAR falls under the housing division because usually they're housing unstable. So therefore, our housing side of it works with these clients to help them find the appropriate housing, working with them, emergency vouchers, any way we can find housing stability for them. We also have a targeted prevention division, which is really geared towards keeping people from being homeless. So if we have people, our clients in the community, or our residents in this community who are at risk of being homeless, they come to us through our targeted prevention. We have case managers who will go out and meet these clients in the community and try to really get to the bottom of what's happening. How can we prevent the homelessness? And we work with the homelessness. Usually it's a connection to mental health services through our adult outpatient and child outpatient programs. So we're really working on the prevention side of it. And then we also have our homeless outreach mobile engagement program, which is our home program, who is dealing with our truly Category 1 street homeless across the entire county. So if they're coming to us through a call, like through our direct phone, our direct line, or from the city of St. Peter, anywhere in the community, we will deploy someone out to go meet them where they're at. And again, work on whatever their mental health issues are, getting them connected to mental health, which I hope you guys see as a theme here, is we're really working on bringing the mental health to the community to shore up the issues that are leading towards the housing instability, at the same time working on housing stability with them concurrently. So we have people that are out in the community both ways, through targeted prevention and through outreach, straight up street outreach. And we also have the lovely ability to have we have a clinician and a counselor who ride on the mobile medical unit, who is attached to this division, who also are out in the community. So that's one more way we're touching the community. So while they're providing the mental health, again, out in the community at all the stops that the mobile medical unit makes, if there is someone that they come across who is housing unstable, which 90% of them are, we will probably connect them with one of our home case managers or a targeted prevention case manager and work on their housing barriers there. And last but not least, the last piece of our division is we have a street outreach case manager who rides with the Department of Health street outreach team. So we have the beauty of the outreach that can connect with the mobile medical unit and tie all of these pieces together. So as a whole program, you can see each of our housing programs are interconnected, but work very independently out in the community as well. So I don't know if I think that is all of our housing. Sorry, I know I just went a little fast there. So I think You know, and as you can see, we've added the adverse childhood experiences piece to it, again, touching on our mental health programs. And I think that's all of our programs within, but I really wanted to showcase our housing programs for tonight to, you know, to reach out. Oh, what age groups do we serve? I'm seeing all the questions here. So we serve all age groups. So like I said, we have programs for, it depends on, are you looking for housing unstable, or are you looking as far as mental health? I can't see here. I'm following the questions. There's a lot of them. Let's see.
Okay, Michelle, Lottie Cuthbertson is asking about the age groups that you serve and asked specifically about housing.
So we would, I mean, the Family Works program starts with school age children. So we're starting with it from kindergarten on. But if it's a family, I mean, we're looking at the whole family. So are you looking at somebody who is 18 that is aging out of foster care, or is youth that is housing unstable? I'm not sure. She answering.
Yes.
So somebody who's aging out of foster care?
Yes.
So yes, I mean, if they're aging out of foster care and they're 18 and older, yes, we would work with them through our program. Absolutely. What other questions? Do we offer volunteer opportunities? So that is something I believe that we do, but that's something that I would have to take up with our CEO and that's a little bit above me, but I do believe we have some volunteer opportunities. I know we have our PB&J run that we look for volunteers for, but in what way are you looking to volunteer? And how do you get signed up? Karen, what I can do is I have your information here. I can get back to you with that. Is there any others or anything in the Q&A box?
They're all coming through the chat right now. Did you want me to go through the rest of your slides, or do you want me to read off some of these questions?
I think we can just go off the questions.
Okay. Well, in that case, we also did you answer what age groups you stop at, Michelle? Perfect.
Oh, what we stop at? We'll
Yes.
work with all ages. I mean, they'd have to be able to live we would provide mental health services to any age. I mean, school age on, but if you're looking on the older side of it, but I don't think we really have a cutoff for that.
Okay. There's also a question. Do you have a referral process to refer families to any of the housing programs you mentioned?
So yeah, so Family Works has the referral process, and that referral comes through the HEAT team. But if you know somebody who is housing unstable that is in school, is enrolled in a Pinellas County school, I would encourage them to go to the school social worker. The school social worker has the direct connection to the HEAT team, and we do have a referral that comes from the school. So all of our referrals for the Family Works program comes through the school. And we work work with them. SOAR, it's a matter, you're gonna have my contact information here. You guys, you can call me. I put both my supervisors on the contact information, and really it's just a phone call asking for services. Or coming in contact with one of our outreach out in the community, and then they will make that for you. Intensive, so as an intensive case, I see Emma, you're asking intensive case manager for housing. I mean, we have targeted case managers for all of our housing programs.
So specifically, because I used to work for Directions for Living, and at one point in time, DFL was able to pay for a hotel motel stay for families who were homeless and displaced. So specifically, did you all bring back that program by any chance?
So right. So that falls under our our prevention program. So I wouldn't quite call it that it's paying for hotel or motel. What we would be doing is assessing them for housing stability. And if they required a hotel, it's short term. Yes, it just depends on where the funding is at each point in the year. But yes, if we have it, we would house somebody in a hotel on a very temporary basis, work with their barriers and work on how to, so we're not just, it's not putting somebody in a hotel, I think, in the way that it was in the past.
Right, I understand. So my next question would be, I apologize, I don't want to
No,
take
that's
up too
okay.
much time.
That's okay.
So my next question is, because I work for Simply Healthcare Plans, and at one point in time, we did have some sort of partnership with you all when Dama was there. Dama was my supervisor as well. So my question is, are you all able to, let's just say, if I have a family who is in need of your services, but has a child who has medical issues, would that be a barrier for you all to help them as far as their housing needs?
As in, no, I mean, if they are part of this Pinellas County, again, it's really just a matter of reaching out to us and setting up a phone call, depending on what the needs are. I mean, I can't, that's kind of, it
It's
would
very
really
broad, I understand.
right, but I mean, we would still, reach out to them. We don't say no to anybody calling and calling us. What we do is we make contact with every single person that calls us and we assess where they're at. And really our motto or mine lately has been, it's not what I can't do, it's what I can do. Maybe I can't do exactly what you want me to do for you, but we can do something and help you
Right.
achieve that stability. I don't believe in not doing anything.
Understand. And then the number to get in touch with you all would be the main number in order for that person to go through the process.
Nope, I actually, if you want to put the last one, if you guys want to take this down, I'm giving you, this is my direct cell phone number. If you were looking, the way I would look at this is I would reach out, if it's somebody who's truly street homeless, I would reach out to the homeless mobile engagement supervisor. And then if it's someone who's housed but is at risk of losing their housing, I would reach out to the targeted prevention.
Gotcha. Okay, so I think that I left Mr. Mark a voicemail today.
Okay, perfect.
Yep, so I left him one. Yep, thank you. I
Okay,
appreciate you.
excellent. Yeah, so Mark is definitely your main contact if they're truly street homeless. Like I said, we track every client, that every person that calls us. I aim to try to call everybody within 24 hours. We do get a lot of phone calls, but we do track them and return them and assess each person. One of the things we want to look at too is what is really the mental health issue that's part of this, because that is the key factor for our main, it's who we are in the community.
Thank you. I appreciate you.
Thank you. Thanks for all the questions.
Wonderful. Thank you so much,
Oh,
Michelle.
I made it to 15. I did it.
You did it. If anybody has any additional questions for Michelle, please go ahead and put them in the Q&A box, and there will be an opportunity to ask more questions and find out more information at the end of this session. Is there anything you'd like to say, Michelle, before we do actually pass it off to Family Resources?
No. I would like to thank everyone again for the opportunity to present Directions for Living. We do have a comprehensive housing program, and I look forward to partnering with everybody that's here this evening.
Wonderful. Thank you very, very much, Michelle. Apologies again for my introduction.
Okay, I won't take it personal.
You know I care.
I know.
All right, wonderful. Thank you so much. Next up, we do have Family Resources, and we have Mackenzie and Kelly here with Family Resources. If y'all would like to take it away.
Awesome. Thank you, Victoria. So my name is Mackenzie Tomasic. I'm the clinical director at Family Resources. Kelly will have a minute to introduce herself, but she is the director of community programs. So Victoria, if you want to go to the next slide to show a little bit about our mission. I'm going to follow Michelle's lead and have everyone go ahead and they can read that on their own. But Family Resources was founded in 1970. It was actually founded by a hotline that was produced from local radio DJs that were getting calls from local teens and youth in the community asking about help, just needing help in general with conflicts in the home, mental health, an abundance of issues. And from that, it actually stemmed into developing a hotline that ran. And then obviously we just grew from there. Our first runaway homeless shelter, which I'll talk a little bit about more a little later, was open in 1978, and our first community counseling program was actually open in 1980. So we've been established in the community for quite some time. And that's, unless Kelly has anything to add about our history, I will turn it over to Kelly to take over for her programs.
Yes, thank you, Mackenzie. My name, like Mackenzie said, is Kelly Azel. I'm the director of our community programs. Victoria, would you mind going to the next slide? Thank you. So just a little bit more about us. So we are a nonprofit. As Mackenzie said, we've been around for over 50 years in Pinellas County and then 30 years in Manatee County. Our belief is that every child should be safe and every troubled teen deserves help, and every family torn apart in crisis should be given the opportunity to mend. If you can move on to the next slide, Victoria. Okay, so we offer a lot of different programs for family resources, but there are a few that we're going to focus on. So our street outreach program, we have a small team of street outreach specialists that serve ages 16. Right now it's 16 to 21, but starting in October, we'll be serving 16 to 24-year-olds. And what we do is we go into the community and we perform street outreach. So we go to parks, we go to stores, bus stops, hospitals, anywhere to look for homeless or at risk of homeless youth. And then we also partner with Pinellas Safe Harbor and Pinellas Hope. We go to both of the adult homeless shelters once a week to look for youth in our age range. Once we meet youth, we complete an initial engagement form and we try to do an intake process with them. And the purpose of the program is to provide services to youth. So ideally, the end goal is to try to find them housing, but in the meantime, we assist them with trying to find jobs. If they're interested in any type of schooling, any other resources such as food stamps, cell phones, any services we can provide. We, when we're on the street, we always carry water, hygiene kits, small snacks, anything that we can pass out to them. And then Victoria, if we can move on to the next slide. Thank you. And then we also have, oh, the slide is a little silly, but we have a center in South St. Pete called Safe Connections, where homeless youth can come to during the day. We have showers, we have a clothing closet, we have hot meals, we have a computer station that they can work with their street outreach specialists to apply to jobs, to work on their resumes, apply to schooling, and then anything else they need. Often we run into youth that don't have their social security cards, so we help them figure out how to get a hold of those. We really just try to provide whatever services we can, and we try to connect with the youth to help them as much as possible. And we also provide laundry as well. We have a washer and dryer where the youth can clean their clothes. And then we do have a office where we're working with hopefully having nurses come into the building again. This is something we did a few years ago, but to provide free checkups for the youth as well. And then if you want to move on the next slide, thank you. And then I'll pass it back to Mackenzie.
Okay, perfect. So this is probably one of our largest service providers as it relates to family resources, is our Safe Place to Be Youth Runaway Homeless Shelters. So we have 3 shelter locations spread out between Manatee County and St. Petersburg. Our Manatee County location is right in downtown Bradenton. And then we have 2 Pinellas County shelters that are located in Clearwater and St. Petersburg. Our Clearwater location we call our North Shelter. It's located off of Union Street near Highland Avenue. And then our St. Petersburg shelter is located off of 5th Avenue North near 34th Street South. So really 2 great central locations near bus stops, right in kind of the hearts of the community. So our shelters provide short-term residential care and other services for youth who are homeless, runaway, in need of respite care or intervention for families who are experiencing a crisis. Whether it's the youth acting out at home or the youth is needing a safe place to run to. So we definitely serve homeless youth, but we also utilize our shelters for a variance of reasons. Our shelters are also really heavily utilized in the truancy court system to try to get kids back on track. And then we serve youth between the ages of 10 to 17 years old at the shelters. So Victoria, if you want to go to the next slide. Okay. So the shelters are called Safe Place to Be. They operate 7 days a week, 365 days a year. So they are never closed down. The only time they close down is if we get a hurricane and most of the kids are relocated from one shelter to another. When they're at the shelter, we really try to instill a sense of schedule with them, of routine. So during the school year, all of the kids are transported to their assigned schools. We've utilized the HEAT team to try to coordinate transportation. We have vans at all of our shelters that will just load up all the kids and drop them off, or we'll walk them to bus stops to ensure they're getting on their appropriate bus so that they can get to school. Once they return from school, they have a general structure for their afternoons, which can include groups, tutoring, chores, and other personal enrichment activities. Each of our shelters is equipped with a counselor, master's level, and a case manager who can really address any of the needs that the family might come into shelter with. So we have a youth that mom is housing unstable, so youth is at the shelter with us. The case manager can connect with the mom to try to assist. Counseling services are provided for both the individual youth, but then also for those families that are involved in our shelter placements due to disruptions in the home or issues at the home. Something that I really want to comment on too is that all of our shelters are very open to any of our youth providers that they have out in the community coming in and still supporting the youth while they're there. So I know that we've had members from the Directions for Living Treatment Works team, PEM's CAP team, Suncoast community team all come to the shelters to see the youth. So we want that partnership, we want that collaboration, because as all of us know, working in Pinellas County, it usually takes two to tango to make it happen. So we really want, the community partners to feel that they can utilize us or lean on us or have that space that they need to meet with their youth and or their families. And then obviously, as we near the end of a shelter stay, we're really looking at that linkage to ongoing services. So something else about family resources and some of the other programs that we offer is we do offer an outpatient community counseling program where youth can be linked to following their shelter stays for ongoing counseling support. Again, just really important to reiterate that every single service we offer at Family Resources is entirely free for the families. So it's super accessible and super easy, especially with our different office locations located throughout the county. There are certain youth, it's usually easier for me to talk about the youth that we cannot serve at most of our programs. And those are youth that are actively open with Children Protective Services at the time. We also cannot take foster care youth. We can take youth that are placed with other guardians or other members of their family, but they can't be actively within the foster care system. And then we can't take youth that are on supervision for delinquency charges unless they are on probation for domestic violence. We do have one of our funding programs is respite for domestic violence youth. So we do have that as a service that, can be offered. The shelter stays last about up to 30 days. So during that time, they're getting a lot of support, a little bit more on the overall day-to-day structure. During the weekends, we coordinate with different community partners for free outings, places to take the kids to. For example, I know that the North Shelter goes to Feeding Tampa Bay once or twice a month to hand out food. The South Shelter will go to local parks or libraries for events. So, we try to get them out in the community, engaging with other people. And then during the summer, obviously, we really encourage outside community partners that can provide something for the youth to come on into the shelter and run it as though a group. So, for example, we have someone that comes into our Manatee shelter. I just thought about her because I just saw her today, who comes in and runs like a healthy relationships self-esteem kind of group once a week. So she'll come in, do her thing with the kids, and then she leaves. So we're constantly looking for opportunities like that, because it just kind of creates more flow, more movement through the shelter. And obviously when you have 12 kids in a shared space, you kind of need that movement for them. To also comment on that, all of our shelters can house up to 12 youth at a time, boys, girls, and at the intake process, we coordinate their bed placement. So obviously we don't mix genders. We do offer safe spaces for LGBTQIA plus youth, and then youth that are more than 2 years apart can't be rooming together in the same room. That's really it about the shelter. Victoria, if you want to go to the next slide. So as I was commenting on, we do have our other community programs. So we have our community counseling, which is free therapy for anyone in the community, for youth and their families. We have our shelter. Kelly has her SNAP programs that I'll turn over to her in a quick second to explain those very briefly.
Yes.
But just for this information on here, we do have our online referral form where anyone in the community or youth or families can go on and fill out. We also have our shelter contact numbers that are operated 24/7. So I'll let Kelly just briefly explain SNAP.
Yes, and then just to add real quick, also with our street outreach program, we do have a van where we can transport youth if they have specific appointments. We usually have an appointment day. And then we also have in our Clearwater office, where our shelter and counseling office is located, or building is located, we do have a street outreach office where we can take youth off based off of appointments. So we have a location, our drop-in center is in St. Pete, and then we have an appointment-only office in Clearwater where we have food, a clothing closet, and computers as well. And then to add for our other programs, we have our Stop Now and Plan SNAP program, which is an emotional regulation program to help children and their families. It's once a week for 13 weeks, and it serves ages 6 to 17. So it's cognitive behavioral therapy. It's a great program. We also have a program that goes into our local high schools to teach in community programs. It's called Safe to Be You and Me. They teach a healthy relationship curriculum, and they also go into our internal shelters to teach the youth that we serve as well. And then we do have a few after school programs that are completely free for children ages 6 to 14. And that about covers it.
Yeah. And Victoria, if you want to go to the last slide, there's obviously Kelly's and I's contact information. You can reach out to either one of us and we can get you where you need to go and help set that up for you. So thank you so much, everyone. And looking forward to you guys sending youth and families our way.
Yes.
Okay, so there's a couple questions on here. So Jennifer asked, do you have volunteer opportunities? We do have some volunteer opportunities, Jennifer. So I can, if you want to private message me your email, I can reach out to you to see what you're looking to help volunteer for. And then Lottie, to answer your question, the length of the respite program, are you referring directly to the domestic violence respite or just general shelter stay respite? Both. Okay. So the length of the stay for the domestic violence probation respite is up to 21 days, I believe. But at that point, we do transition the kids over under the guise of our regular shelter youth. Nothing really changes. It's all like a logistical thing that we have to do on our end. We do keep the kids for up to 30 days at a time. At the end of 30 days or getting close to the end of 30 days, we're really having sit-down meetings with the youth and their family to really evaluate, okay, what's going on? What progress have we made to try to help alleviate whatever the stressor is that's leading to the housing instability or the issues at home. So we have had youth that have stayed with us a little bit longer. I think we had an actual true homeless youth, a set of siblings, 5 of them that stayed with us for about 7 months or so up at our shelter. But we were working with the mom to really ensure that in her community program that she was working with, I think she was at HEP, don't quote me, but really working with her and her team there to ensure that she was doing what she needed to do on her end to secure housing. So that was very much like an intensive communication process. We really don't want to leave kids in the shelter for that long, because after a while the youth tend to digress because there's a lot of kids moving through there. But yeah, so up to 30 days, reevaluated for ongoing need. The average length of stay, I would probably say, is like 7 to 10 days, based off of the current youth that we've been seeing. So.
That is wonderful. Thank you so much, Mackenzie and Kelly. I really appreciate that. Mackenzie and Kelly, there was also a question about donations, supply donations. If you wouldn't mind typing that in the chat, because I am sure that more than just Tina who asked are curious. So if you could go ahead and provide that information, that would be great. And then there was an anonymous question asked. I do want that person to know. I'm going to save that question for the end and then ask our panel if they can answer that. So just know that we are not ignoring your question and we will address that question. So if you have any other questions for Family Resources, please pop those in the Q&A box and we will ask them during the Q&A session. Okay, I'm going to stop sharing my screen now, and I am going to introduce Carrie with Area Agency on Aging of Pasco and Pinellas counties. And Carrie, did you want to share your presentation?
Can you hear me?
Yes, we can.
Okay, good. It's very dramatic on my part. I apologize. I didn't mean to do that. I was having a full conversation, and
you're good. If we
sorry.
haven't all been there, it's not 2024.
That's so funny. So I think what I'll do is, how about I just go ahead and use the slides, the information that you have up. It was very helpful, Victoria. Thank you so much.
No problem.
And I am with the Area Agency on Aging of Pasco Pinellas. We serve both Pinellas County and Pasco County. We are a nonprofit, and we fund, coordinate, and provide services for seniors age 60 and older. We do have one program that provides services for those younger than 60, and that is our Alzheimer's Disease Initiative program, and it's 18 and up due to, in some cases, early onset. So it does allow that. But we are one of 11 area agencies on aging in Florida, and we're one of more than 600 nationally. And we provide many key services. One service that we provide is information and referral services. And we operate the helpline. And we are so fortunate to have amazing staff that answer calls, return calls. And we receive now more than 1,000 calls every week. And it's close to 30,000 calls annually. And we have a designated time that we must return calls. So when our call volume goes up, we don't add more staff to that. We just get it done. And so sometimes for those that call our helpline, please know you may have to leave a message, but we return the call very timely, and we track every single call in our return time. But we're fortunate to have great staff. And when someone calls the helpline, it can be a senior, it can be a caregiver, it can be an adult with disability, or someone calling on their behalf. And with that, they're provided, it's kind of a conversation back and forth of what the person is seeking or needing. And then the helpline provides resources to the person if that's what they need. If they also determine that the person needs a screening or ultimately an assessment, then that is completed. We do the initial screenings for the Medicaid program, and if someone is then ultimately enrolled into the Medicaid long-term care, managed long-term care program, it moves to the Department of Children and Families. So we don't oversee that part, just the initial part. And that's really done to allow kind of a seamless entry. So someone who calls our helpline seeking services for either themselves or someone that they're calling for in any of those three categories, our staff, our members are able to assist them by providing information and resources and referring them to who they need, or we are able to move forward an assessment process either for services that we provide directly or provide through a provider in one of our two counties, or do a screening, as I mentioned, for an assessment for the Medicaid managed long-term care program. And as funding allows, we're able to provide those services, and we provide many different types of services, which I just wanted to cover. As this slide mentions, we provide different types of food and nutrition programs. We provide transportation. We have a whole program dedicated to preventing elder abuse as well as fraud. We provide programs, evidence-based programs about staying mentally healthy. We do, as well as physically healthy. We also provide counseling, mental health counseling, both in person and virtually. We do unbiased health insurance counseling through our SHINE program, which is really exciting, especially come open enrollment time. And that is an amazing program. And we have a lot of different programs related to home choices as well as safety for seniors or, again, caregivers or adults with disability, staying healthy and active. We also have a kind of a very a program that grows and grows, and that is our Diapers for Dignity program, which really came as a result of calls to our helpline that we simply couldn't find a resource for, which happen to be those that need incontinence products. And for those that have bought incontinence products, they're very expensive, and you need them and need them and need them. And so with that, we're able to fundraise and we receive donations, and then we have different distribution sites in our two counties. And that's a very a popular program for us. We also do a lot with preparing for disasters. Right now, hurricane season has begun, and we do a lot. We have two defined plans for both Pinellas County and Pasco County related to emergency management. We always encourage those that need to be on the special registry that they do that before a storm is called, and we assist in that process. We also provide care for those, as I mentioned, that have dementia. And all these services are in-home services unless they are in a congregate dining site or adult daycare, which we also provide. We have a program specifically for the LGBTQ plus community, and we do a lot with that program, and it's really exciting to watch. And we always encourage social connection among our seniors, and it's so vitally important. So we do a lot of different types of programs that are social but have ties to general health. So if you could advance the slide, Victoria, I would sure appreciate it. So as I mentioned, we provide services for individuals with disabilities that are both funded through federal and state dollars. We do this directly, or we're coordinating and funding other providers and then monitoring that the service is provided with the highest of quality and as it's supposed to. And we also, as I mentioned, have programs and services for caregivers. So with that, I wanted just to also talk about, as I started talking about, is our helpline. The number to call for those that are seeking services for someone age 60 and older or for caregivers or adults with disabilities is our helpline, which is 1-800-96-ELDER. And that's 1-800-963-5337. And as I mentioned, you may have to leave a message, but our staff is excellent. It just really depends as call volumes fluctuate. But they do an excellent job in returning the calls, and doing so, they provide up-to-date information regarding services that we either provide or we fund or available in the community. And and they do it with such care, which I so sincerely appreciate. So I'm happy to take any questions now or in the chat. Thank you, Victoria. I see you put the number. Thank you for that. Our website is agingcarefl.org. We have a lot of information on our website as well. And I see someone, I believe, is inquiring about services in Hillsborough County. In that county, they have an area agency on aging as well, who operates a helpline for 5 counties. And you can still call the 1-800-963-5337 number, and it rolls to the correct helpline depending on your area code. And we can always connect you as well if it rolls to us to the correct one. Oh, I see someone received a ramp. Yay. we do a lot of home modifications. Lauren, that thrills my soul. I'm just so excited. I'll tell our team who handles that. We had some funding, and we continue to have funding for ramps. We just funded Disability Achievement Center for a small grant. It was like $50,000 to install ramps. And we do that because it's so important. You know, when we either rent a home or purchase a home and live in it for a while, you know, we may change in how we need to be able to move around in our home and in the community. And those ramps are vitally important. And there's the ones that they're installing now are movable. The ones that Disability Achievement Center is installing, which is so helpful. They can be certainly moved and adjusted or moved to a different location, which sounds like a small thing, but it is so important. So thank you for that, Lauren. And if you're asking if we have volunteers, our SHINE program, which is our health insurance counseling program, that is a national program, and we provide it here. That is a vibrant, amazing volunteer program for those that are interested in assisting others with their Medicare choices and their health insurance choices. They are highly trained, amazing volunteers who provide unbiased health insurance counseling. And they can, so we do have that volunteer program. We also do some other volunteer things, and just call our helpline, the number that I mentioned, and we'll connect you with whatever you're looking for. And if that includes volunteer opportunities, we can do that as well. And our providers, like Neighborly Care Network, they do home delivered meal routes through wonderful volunteers. They have volunteers throughout all of their systems within this county of services that they provide. And so again, if you're interested in volunteering, just give our helpline a call and we'll connect you to whatever type of volunteer opportunity you're interested in. Any other questions?
Thank you, Carrie.
Thank you so much. Thank you for the invitation.
Absolutely. We do have a few more minutes for Carrie if anybody has any questions.
And if I could add, we have one other program. This is a new program through a local funder. And it's a local funder who was interested in funding eviction mitigation for seniors in the St. Pete area. So it is a new program that it's kind of time limited, but we're fortunate we're able to provide up to $1,000 to a senior that is experiencing housing issues or possibly being evicted or everything in between. And it's targeting 8 zip codes. They're all in St. Petersburg, and they have the highest rates of eviction. They have, you know, many things that we were tracking regarding demographics of those that are seeking services related to housing. And that's really because our call volume related to those calling about affordable housing needs or that homelessness was being threatened, that they were on the verge of becoming unhoused, or it was like a crisis. And so those types of calls have increased by 40% for us in the last 2 years. And so with that, we have really leaned into this issue, and it's an issue we're new to this topic. So we are learning a lot and listening to those that know far more than we do, but we're trying to do more as it relates to providing seniors with affordable housing options in both Pinellas County and Pasco County. So
I have to say, Carrie, that is wonderful to know. I am sure I'm not the only person who was, while you were talking about that last program, texting their team to make sure their team knew. So
yeah,
thank you
and,
for that.
and it's
Or the person
we're happy
access
to.
those funds.
So what they would do, again, they would call our helpline, and if someone is in need of these types of issues related to affordable housing and they have an eviction threatened or they're in that housing crisis and they're in St. Pete, please give us a call. We're fortunate that this local funder, it feels passionate about it, and we have a process in place. So call our helpline, the 1-800-963-5337, and our staff takes it from there to do an assessment. Okay.
Thank you for the question, Lottie, and for the answer, Carrie. Carrie, before we finish up your session, somebody also wanted to clarify if somebody would be eligible for that funding if they lost their house due to fire.
I think we still go through the eligibility process of this funding that this local funder has provided. Again, I know I sound like a broken record. Please call our helpline and they will put you in touch with our staff member that is overseeing this program. For someone that has lost their home in a fire, I would have many more questions as to is it fire damaged or they have no home? So that, there's many more questions, but the key thing is to give us a call, and we would, collaborate from there and see how we can help you. Okay. Whether it's this program or potentially another program, but please just give us a call and we'll see what we can do.
That is wonderful. Thank you very, very much, Carrie. I really appreciate that. Okay, so now it's time for our general questions. If you have questions for any of our presenters from tonight, now is the time to ask. So I'm going to go ahead and get us kicked off. Carrie, I'm still going to keep you here to answer this one. Does your program include people with disabilities and not just seniors?
Our information and referral services that we provide through our helpline is, the acronym is ADRC. So it's Aging Disability Resource Center. So to answer your question, we are able to provide information and resources to those that are under the age of 60, but have a disability of some kind and are seeking information about available resources. So yes, and then from there, it just depends what else they're needing, if we're able to provide it or we connect them to who does in the community. That's a great question.
Thank you very, very much. There's also a question, I'm going to ask this to all of the panelists about about job readiness training and programs that help adults experiencing homelessness secure work. While you answer that question, for the person who asked it, I'm also going to put some information about HLA's Workforce Development Program in the chat so that you have that referral link as well. But for our panelists, do you have or know of any volunteer programs that help street homeless adults obtain jobs?
Victoria, in all honesty, I am not aware of that, but I'm happy to look into it and see what we can find out for you.
Okay.
I wish I had a better answer than that, but sometimes a question that I'm not able to answer, sometimes I just appreciate the question. So let me see what I can find out. My view would be more people age 60 and older, unless they had a potential disability, but we're happy to explore that. It's a great question.
Wonderful. Thank you. Michelle, it looks like you came off mute and you might have an answer for Karen.
I mean, I don't have the full answer. I can tell you through directions, our Family Works program definitely covers that aspect of it. If they're housing unstable and unemployed, that's one of, we're looking at all aspects. So what our case managers will spend a lot of time working on resume building, working with our families on, whatever the barriers are there. We also have SOAR. I mean, SOAR is our Social Security outreach. However, not everybody necessarily qualifies or is denied. And I know from experience, we have worked really closely with Voc Rehab in addition to finding are they employable? Maybe there's some barriers to employability. I know that's some of the areas that we would explore, but I can tell you our Family Works program, our housing case managers would explore all of that with them. I mean, that's what our outreach does. I mean, it's not necessarily employment services in that aspect, but it's definitely working on barriers. So I don't know if that gives the full answer to the question, but from the directions for living scope, that's how we would handle it.
Thank you very much. Mackenzie, did you have anything to add?
Yeah, I just don't know about, I think, Karen, you're asking about volunteer programs that you can help get involved with. I think there's, like Michelle commented, and I know a lot of the shelters offer a lot of employment assistance. So I think contacting those programs specifically to inquire if they are open for volunteers. I know that there's the PERK program has employee assistance, HEP, oh, Don beat me to it. HEP has employee assistance. The case managers at different shelters. So if you're looking for an opportunity, I would just recommend reaching out to the specific programs in the community and seeing if they're open for volunteers. But there's not a volunteer program that is set up for that specifically, to my knowledge.
Excellent. Thank you all very, very much. We also had a participant ask, and I'm going to go down the list, and if you could give me just a brief answer for what your best response might be, I would appreciate it. So this participant asked, when I see a street homeless person in my area, what suggestions would you have to best help that person? At this time, I'm getting a meal and oftentimes giving cash. Would you recommend doing anything differently? So let's start at the beginning. Jennifer, do you have any suggestions for this individual?
Oh, that's loaded. Yeah, can you repeat it again? I heard the cash. Can you repeat it again for me, Victoria?
Absolutely. So do you have any suggestions for how an individual can best participate in outreach? The individual right now is offering meals and cash.
Oh yeah. So, well, I could be on here a while with that, but I personally wouldn't recommend giving cash out. I know that I take my son from time to time and we make sandwiches and we hand them out to the community. I do think the food, and my personal opinion, is the best way to do that by giving back. So
Wonderful. Thank you very much. Michelle, did you have anything to add?
Not necessarily. I mean, I think if you're coming across them in your neighborhood and you want to be helpful, I think a meal is probably, and it's a tough scenario because it's just really, I think there's a lot of variables to where they are. So many other, like I have about 9 other questions I would ask first. But I think if they're looking for ways to help, I mean, money, I don't necessarily think is the best way, but a meal, something like that, they maybe, I would go along those same lines.
I appreciate that very much. Mackenzie and Kelly, did you have suggestions for how to best engage in outreach as an individual?
Yes, I would say if you're talking, sorry, Mackenzie.
No,
If
go
you're
ahead.
if you're talking to the individual, you can always offer them resources. So the adult shelters in Pinellas County are Pinellas Safe Harbor and Pinellas Hope. Those are great resources. Obviously, family resources. We have multiple shelters if it looks like a younger person. And then 211 is always a good resource for anyone as well. So that's what I would say. Mackenzie, I don't know if you have anything else to add.
Yeah, I would just echo too that if you're very familiar or integrated within the community, potentially touching base with any of the programs that have the street outreach teams. So, for example, I think there was someone on here. I used to work with her, Kathy. Yes. Oh, there you are. Yeah. So, connecting them with the street outreach teams for like local law enforcement that might be able to help as well. But I think it can be difficult, like what Michelle echoed. There's a lot of questions, especially as a clinician, that I would want to ask and inquire. But if I'm just out on the community or out driving around, sometimes just saying hello can be helpful. I've actually had old copies of the yellow booklet that the HLA team puts together, and I've just handed those out to folks that were also interested in looking into resources as well. So.
Excellent. Thank you very much. And Carrie, did you have anything else to add?
No, I think everyone else, I agree with the other comments that have been made. And I think resources is also very important to provide those as well.
Wonderful. Thank you very much. And I did put a link in the chat to request the Pinellas Homeless Resource Guide. In case anybody wants any of those little yellow books, pickups will be available this month. So please go ahead and request those books if you need them. Those are a great thing. I always keep some in my car. And if I have a book and a protein bar or something like that, I will always hand them out to somebody. So great question. Thank you very much for asking whoever it was that asked that question. Do we have any other questions? Oh, you know what? Before I move on, I do want to acknowledge some of the great suggestions that have also been made in the chat. In the chat, folks are suggesting socks as a resource, cooling items in this intense heat. A bottle of water goes a really long way, a cooling towel, something to help people stay cool in this really extreme summer heat. A smile, a friendly hello, a bus pass, all of those things go a very long way. So thank you very much for asking and for everybody for participating in that answer. Do we have any other questions for our presenters tonight? All right. Well, do we have any resources that anybody would like to share? I'll go ahead and start. We have just booked a trauma-informed care training series that COC members will be invited to join. The first session is going to be on the 31st of this month. And all of these are going to be virtual. It is a 5-part series that COC members and COC providers can participate in. So please go to our website and check that out and register. Does anybody else have a resource or an event that they would like to share?
I'm with Sela Freedom. My name's Cassie Brewer, Awareness Advocacy Liaison. And If you go to our website, selafreedom.com, we are changing it to org. It's just taken a while, but it's SELAH freedom.com. And we do provide courses for training for awareness and prevention for teens along with adults. And then also we can also come to and give presentations as well to your organizations, more about awareness. And then we also go into schools. We'll be going into Sarasota this fall, into their high schools, all the high schools in Sarasota. We will be doing prevention training on sex trafficking. And then also we'll be working here in St. Petersburg with the Parks and Recreations Department. So there'll be 13 locations come this or the summer of 2025. And we'll be working on prevention as well and providing lunches for those that will be in attendance. So if you want to do that or contact me, Cassie, Kassy at SELAH, SELAH freedom.com. I'll be glad to communicate with you as well. But those are some of the things that we offer online, and it doesn't cost anything.
Thank you very much for sharing, Cassie. I just shared that information in the chat. Will you please make sure that I didn't misspell anything before everybody takes that home and considers it gospel, Cassie? Thank you very much. Does anybody else have a resource or information or event to share?
I would like to offer some information that I was given by one of my neighbors. It's for seniors 64 and up, and it's a Medway Medical Center, and it's also Simply Healthcare. They help people. The address is 1012 Druid Road East in Clearwater. Because I'm from Largo, so like I kind of like handle like the areas, you know, from like Dunedin down to like Ulmerton and stuff like that. And they you can apply for public assistance at this place, Medicare savings programs, food stamps, the free government phone and tablets and cash cards. This is just a little thing because they had a event on the 2nd giving out hurricane supply bag and stuff to come tour the facility. This is a place where they can there's labs there, like it's an all-inclusive place for people that are in that area and that are 64 and over. They get free haircuts. They have just like little parties, just a little place for people to come and kind of hang out and stuff. So and that's, again, I don't know how I would be able to give this information. I would like to talk to my neighbor and ask her if it's okay to give that information, and then I could just like email that to you, Victoria.
That sounds perfect.
But yeah, it was a really nice place right there on the corner of Druid and MLK.
Wonderful. Jennifer, can you go ahead and put that address in the chat for folks?
Yep.
Thank you very much. Do we have any other resources to share? And also, Cassie Brewer has added her contact information into the question and answer box, and I'll copy that into the chat box just in case anybody's looking for it. Any other questions for tonight? Any other resources for tonight? Okay. Well, with that in mind, thank you all so much for joining us. I really sincerely appreciate you taking the time to present, to listen to these presentations, and to ask such awesome, thought-provoking questions. Thank you all for your commitment to ending homelessness and to helping the most vulnerable members of our community. I I really sincerely appreciate everybody on this call. So thank you very much. You will receive a recording of this session, the presentations, and the information that was shared after this session. So please make sure that you check your inbox. I should be in there within the next week. Thank you all very much. And I hope to see you at the August 13th COC membership meeting.
Bye, Victoria. Thanks a lot.
Thank you all.
Thank you,
Take care. Have a
Victoria.
good
Thank
night.
you, everyone.
Mhm.
Thank you.
Appreciate it.